A memorial service for intern Dr Alulutho Mazwi will be held today at the Prince Mshiyeni Hospital in Durban. The 25-year-old died last week while on duty, allegedly after being forced to work despite being unwell. The EFF and the Public Servants Association are leading a picket outside the hospital ahead of today's ceremony. And Newzroom Afrika's Pila Mthembu joins us now from that location. Pila, good morning. It's such a sad and somber morning, but we also know, after having spoken to some of the activist groups and unions in the space, that some of the alleged circumstances surrounding the doctor's passing seem to be endemic in hospitals up and down South Africa.
Indeed, Iman, and that is why you are seeing this picket behind me going on. I'm just going to allow my colleague to show you what is happening at the very moment. During our last live crossing in the past hour, they had been PSA members here, but now what we can see is that they are now joined by some of the EFF members as they continue to trickle in here. But we're expecting for the numbers to increase as the day progresses, as they all stand in solidarity here, saying that they are demanding justice for Dr. Mazwi. As you'd remember that last year, the doctor collapsed and died whilst on duty in this very hospital. So there have been allegations around the treatment of staff as well as interns, especially when it comes to the pediatric ward, where there have been reports also by the staff and also by some of the doctors who had been speaking anonymously, saying that there's intense bullying as well as harassment and also the abuse of power by superiors here. As you'd remember that the reason why, as this though is still being investigated, the circumstances leading to the passing of Dr. Mazwi is that he had reported that he was ill to report for duty, but then his supervisor allegedly insisted that he does report for work. I'm going to bring in the PSA's Mlungi Sindlovu to speak to us. This is not the first, protest around this issue or the situation, regarding Dr. Mazwi. And I would like to know, why are we having this picket again here this morning?
As PSA, we continue to picket for one reason: the victimizations, bullying of staff, shortage of staff, abuse of power, system failure has reached a critical point in KwaZulu-Natal. It is for this reason we are saying we're calling upon the minister to visit, not only to pronounce what needs to be investigated. They must come and be able to move from their comfort zone. We have came here because we are aware in terms of our statistics that there are 16 vacancies of doctors. These are budgeted posts. Why these positions are not filled? You've got 42 positions of professional nurse. Why these positions are not full? You've got over 40 positions of admin staff support. So we came here to put more pressure, because justice delay is a justice denied. Department has not shown us concrete actions that they are taking. What we have seen is the PR exercise. This has nothing to do with us as individuals. We are calling for transformation in the health systems because our people relied on this.
And also, when it comes to the investigation that you are speaking of, are you confident, though, that the results of that particular investigation are going to be transparent and that they are going to be honest? What's your take?
So we always have hope as human beings, but in the past, if you lose statistics where we have sent over 7 memorandums to the department that we're talking about the same issue, so the department has not shown the interest. It's not the first time to say they are investigating. Each and every time they say they investigate, we are saying they must run with their own process because it's their obligations. But we need an independent body like Public Protector, Human Rights Commissions to investigate the healthcare systems, because the message that we are getting is not only here at Prince Mshiyeni, it's across the province. We are saying enough is enough. These things has nothing to do against the sitting MEC. Unfortunately or fortunately, as the head of the department, she must take full responsibility, because we're also getting the report that some of the CEO are not allowed to exercise their constitutional responsibility of filling positions. They get detected at the provincial level. If you look at the monitorium, that is how it is placed. This hospital has become a mental hospital where our members cannot take anymore because it's a regional hospital with 18 clinics. You still need to pick more hospitals.
Thank you so much for your time. That was the PSA's Mlungisi Ndlovu speaking to us essentially around why they have returned to actually stay to this picket that you see outside. But also what is, sad, Iman, is those conversations that we have been having with the family of Dr. Mazwi. We know that at this point, they cannot confirm when he is going to be laid to rest, as his passing comes just after his grandmother had passed away, and that it's only at this point the funeral service of his grandmother that is going to be held this coming Saturday. But they've also been saying to us that whilst Dr. Mazwi had been working for this particular hospital as an intern, is that he was even unable to come back home. As you know, he is from the Eastern Cape, and it got into a point that he had been missing out on family gatherings as well as some of the funeral services that were actually held at his home. So these are some of the concerns that they have also been saying, and that is why they are demanding that justice is served for him at this point. Back to you.
Tembu, thank you for that. We'll check back with you a little bit later on.